You tried the little blue pill and it didn't work. So, what should you do next? I'm Dr. Rena, a urologist and pelvic surgeon, and today we're going to discuss how to take medications like sildenafil and tadalafil so they work as effectively as possible each time. Let's begin with the basics. When a man becomes aroused, his body releases a chemical called nitric oxide, often referred to as NO. When the body detects this nitric oxide, it triggers the creation of another chemical called cyclic guanosine monophosphate, or CGMP. This chemical relaxes the blood vessels inside the penis, allowing blood to flow in and fill the erectile tissues. As these tissues fill with blood, an erection occurs. In men with erectile dysfunction, or ED, there is an enzyme known as phosphodiesterase type 5, or PDE5. This enzyme breaks down CGMP too quickly. When that happens, blood flow to the penis drops sooner than it should, making it harder to achieve an erection or maintain one that has already started. Medications like sildenafil and tadalafil, commonly known as Viagra and cialis, are called PDE5 inhibitors. They work by blocking the activity of the PDE5 enzyme. As a result, CGMP can build up and remain active in the body longer. This keeps the blood vessels open and relaxed, allowing more blood to flow into the penis and stay there longer, which helps create and maintain an erection suitable for intercourse. However, many people try these medications once, don't see immediate results, and then stop using them. But what actually increases the chances that they will work well for you? What helps optimize your response to sildenafil? Number 1. Don't give up if it doesn't work the first time. Try again. It might sound simple, but you may wonder why it would make any difference after the first attempt. Interestingly, researchers have studied this. In one study involving 1,176 men with erectile dysfunction, participants were enrolled in several double-blind, placebo-controlled clinical trials between 1996 and 1998. Researchers looked at what happened when the men took sildenafil, had sexual stimulation, and attempted intercourse. The results were interesting. During the first and second attempts with sildenafil, only about 54% of men succeeded the first time, and around 64% the second time. But by the eighth attempt, success rates climbed significantly. About 86% of the men were able to achieve successful intercourse. So what does this tell us? It shows that the first time you use it, you might feel nervous or anxious. You might not time it correctly. You might have eaten too much beforehand, or there could be several other small factors that affect how well the medication works. As you become more familiar with using it, your comfort level increases, your stress goes down, and that makes it easier for your body to respond with an erection. Stress, after all, is one of the biggest enemies of a healthy erection. Now let's move on to the next point. The second tip is to consider increasing the dose. Many times when these medications are first prescribed, your primary care doctor, or even some online services that provide erectile dysfunction treatments, will start you on a lower dose. However, higher doses are often available. In one study involving 137 men who were referred to a urology clinic because sildenafil had supposedly not worked for them, researchers discovered something interesting. About 55% of those men had only ever been prescribed the 50 milligram dose. But sildenafil can be prescribed up to 100 milligrams. When these men visited the clinic, they were given proper instructions on how to use the medication, and, when appropriate, their dose was increased. After receiving this education and the correct dosing, about 54% of the men who had previously been considered treatment failures were eventually able to achieve successful results with sildenafil. Number 3. Take it the right way. You might be wondering, what does the right way even mean? After all, you simply put the pill in your mouth and swallow it. Sounds straightforward, right? But there are actually a few important steps involved if you want the medication to work as intended and help you achieve an erection. First, sexual stimulation is necessary. These medications do not automatically create a random erection just because you took a pill. You need some form of stimulation, something you see, hear, feel, or even smell that arouses you. That stimulation begins the release of nitric oxide in the body, which starts the entire erection process we discussed earlier. Next, you should take the medication at least 30 to 60 minutes before sexual activity, though it can be taken up to 4 hours beforehand. These medications need time to work. They must first be absorbed into your bloodstream, then converted into their active form, and finally begin affecting the enzymes involved in erections. When you take the pill 30 to 60 minutes ahead of time, it gives your body enough time for these steps. Absorption into the bloodstream can take about 30 minutes. After that, the medication is processed in the liver and converted into its active form, which may take another 15 to 30 minutes. Finally, it begins blocking the PDE5 enzyme and allows cGMP levels to build up, which can take another 15 to 30 minutes. That's why the commonly recommended timing is around 30 to 60 minutes before sexual activity. Typically, the medication reaches its peak effectiveness about 1 hour after taking it. If it's not always convenient to take it exactly 30 to 60 minutes before sexual activity, that's okay. You can even take it 2 to 4 hours beforehand. It doesn't have to be timed perfectly, but there still needs to be enough time for the medication to be absorbed and begin working in your body. Next, try to avoid high-fat meals. Foods that are high in fat can slow down the absorption of sildenafil into your bloodstream. This happens because fat takes longer for your body to digest compared with other nutrients. As a result, it can delay the release of the medication from the stomach into the bloodstream. If you take sildenafil along with a heavy, high-fat meal, it may take longer for the medication to start working, or in some cases, it may not work the way you expect. You might still experience some of the side effects linked to the drug, but not the erection benefits you were hoping for. Finally, focus on improving your overall health. This is something many people underestimate. Erectile dysfunction is often related to problems with blood flow, also known as vascular dysfunction. Conditions that affect circulation, such as diabetes, high blood pressure, and high cholesterol, are very common causes. In fact, I can't count how many times patients have come to see me for erectile dysfunction, and during their evaluation we discovered previously undiagnosed conditions like diabetes, high cholesterol, or hypertension. In one study involving 521 men with erectile dysfunction, participants received counseling and treatment aimed at improving their lifestyle and overall health. After addressing those underlying factors, the men achieved a success rate of about 82% while using medication like sildenafil. So how did the researchers help these men improve their health in the study? First, they reviewed their medications to make sure none of them were interfering with erections. For example, some men taking certain blood pressure drugs were switched to alternatives that are less likely to cause sexual side effects. If a patient had high blood pressure or high cholesterol, they were started on treatments to control those conditions. And of course, if someone was smoking, they were strongly encouraged to quit, or at least significantly cut back. If you didn't already know, cigarettes are a major enemy of healthy erections. Smoking damages blood vessels and restricts blood flow, so quitting smoking is one of the most important steps you can take if you want to protect and maintain your erectile health. In the study, participants were also advised to limit their alcohol intake. On the days they took sildenafil, they were encouraged to have no more than 1 drink, and on other days, they could have up to 2 drinks per day. In general, the recommendation was to keep alcohol consumption under 7 drinks per week, ideally even less. They also received a hormonal evaluation. If testing showed that their testosterone levels were below what is considered normal for their age, those patients were treated to help raise their testosterone back into a healthy range. Finally, it's very important to talk openly with your doctor about these concerns. I understand that discussing sexual health can feel uncomfortable, and bringing up problems like this isn't always easy. But if you want these medications to work, and you're not seeing the results you hoped for, you really should review the situation with your physician. Unfortunately, many doctors don't always bring it up first. In one survey of about 1,600 primary care physicians, Only 45% said they routinely asked patients about symptoms of erectile dysfunction. That means many people never get the opportunity to discuss it unless they raise the topic themselves. As I mentioned earlier, I frequently see patients who were prescribed very low doses of medications like sildenafil or tadalafil, and they didn't even realize that higher doses might be available to them. Sometimes the solution can be as simple as asking your doctor about adjusting the dose, trying tadalafil instead of sildenafil, or exploring other treatment options. The bottom line is this: don't feel discouraged if the medication doesn't work perfectly the first time. Give it a fair chance. Try it several times, ideally at least 8 attempts. And make sure you discuss it with your doctor if you're still having trouble. Don't hesitate to ask questions. Ask whether a higher dose might help, whether there are other alternatives, or even whether you should be referred to a specialist if additional support is needed. And as always, remember to take care of yourself, because you truly are worth it.